The pylorus is the junction between your stomach and small bowel. It opens and closes, allowing food to pass into the small bowel. The duodenum is the medical name for your small bowel. If the pylorus or duodenum becomes narrowed, eating and drinking becomes difficult and food intake can be reduced. Placement of a specially designed metal, mesh-like tube called a stent across the narrow door-blocked area of the pylorus or duodenum can make it easier to eat and drink normally, as food can pass through the digestive system with no hold-up. Prior to the insertion of a pyloric or duodenal stent, other tests such as endoscopy or a barium swallow, or a CT scan have shown that your pylorus or duodenum has become blocked. Your doctor will have discussed with you the likely cause of the blockage. There are different treatments available for people with a blocked pylorus or duodenum. A stent insertion has been proposed as the best treatment option for you. You should make sure that you have had the opportunity to discuss your treatment options with your doctor. If you feel uncomfortable about having this procedure carried out, then you can decide against it. Your decision will be fully respected and your doctor will be happy to discuss alternative options. A pyloric or duodenal stent insertion is normally carried out under sedation. Sedation is not a general anesthetic and will not put you to sleep, however, it may make you feel relaxed and possibly drowsy. A painkiller injection is normally given along with your sedation, which will help you to feel more comfortable during the procedure. Local anesthetic spray may also be given to numb the back of your throat. The nurses on the ward will prepare you for your stent insertion. A cannula will be placed in your arm or hand. This will be used during the procedure to give you sedation. You will be asked not to eat or drink anything before the procedure to ensure that your stomach and duodenum is empty of food and fluids. Patients often need a nasogastric tube placed for a day or two before the procedure to make sure of this. You will need to wear a hospital gown and remove any tight clothing for your comfort. You will be asked to remove spectacles, dentures and hearing aids prior to the procedure starting. Please inform the nurse or endoscopist about any allergies or reactions to medications you may have had. The potential complications of your stent insertion are: perforation. It is possible to cause a tear in the lining of the esophagus or stomach. The risk of this happening is in the region of 1 to 2%. Hemorrhage. It is possible to cause the bowel to bleed. The risk of this is happening soon after the placement of a stent is low, probably below 1%. Stent migration. The stent may not remain in place, moving either above or below the narrowing. There is little reliable data on how often this may happen. The risk is probably below 10%. Jaundice. Depending on where your stent needs to be placed, it can sometimes compress the bile duct which opens into the duodenum. If this happens, you may need further procedures to treat this.